Hello there. Welcome to this presentation. My name is Pascal Menezes, and today I'm going to talk about healthy living and particularly focus on why so many people are suffering from chronic diseases. Before I go any further, I must inform you that I am not a medical doctor, I am not a nutritionist, or I'm not a scientist. I am just an ordinary man, an enthusiast in my own health. In this video, I will share the knowledge I gathered during my online research, my personal experiences, and my endeavors of living a healthy lifestyle. Along this journey, I have come to believe that the modern medical system often focuses on managing and alleviating symptoms rather than addressing the root cause of illnesses. As a result, people are put on medication to suppress only their symptoms with no healing in sight. However, I believe that God has given us a healing body, and given the right nutrition, healing is possible. This video is not to give the viewer any advice on any aspect of health, but will focus on my understanding of the reasons that I think make us unhealthy. It does not provide any suggestion on how to maintain good health except by implication. So let us explore what is healthy living. Health is a state of complete physical, mental, and social well-being. It is not merely the absence of disease or infirmity. It encompasses the ability to lead a fulfilling life, maintain balance in daily activities, and adapt to stress and challenges. Healthy living involves proper nutrition, regular physical activity, adequate rest, and a positive mental outlook. It also includes the ability to form and maintain relationships and effectively manage emotion. Health is influenced by genetic, environmental, and lifestyle factors. And achieving optimal health requires a holistic approach that addresses all aspects of a person's life. This presentation will focus mainly on the unhealthy food choices and the unhealthy nutritional behaviors, and will also refer to the lack of physical activity and its effect on an individual health. The video explores reasons why people get diagnosed with chronic illnesses. Chronic diseases such as heart disease, diabetes, and certain cancers are increasingly prevalent in modern society, largely due to bad nutritional behaviors and dietary patterns that result in insulin resistance and metabolic syndrome, and that leading to an increased incidence of chronic diseases and a decline in overall health. Largely due to lifestyle and dietary choices, a significant contributor to this rise is the widespread consumption of processed and unhealthy foods, which are often high in sugars, unhealthy fats, and refined carbohydrates. Additionally, sedentary lifestyle characterized by minimal physical activity and prolonged periods of sitting exacerbate the risk. Unhealthy eating habits like overeating and frequent consumption of fast foods, sugary beverages, and snacks, coupled with insufficient intake of organic, natural, animal, and plant foods, is also adding to the risk. These bad nutritional behaviors over time, maybe several months or years, develop into insulin resistance and metabolic syndrome, and then that contributes to a cluster of conditions including type 2 diabetes, heart disease or stroke, high blood pressure, obesity, that is excess body weight around the waist, and PCOS, etc. In other words, these behaviors and dietary patterns create a perfect storm leading to such chronic diseases and a decline in overall health. Our bodies need energy to do everything from moving to talking to learning to thinking. Our bodies get the energy it needs from the foods we consume through a process called metabolism. Metabolism is a chemical reaction in the body's cells that change food into energy. So, why are we suffering from chronic metabolic diseases? To understand the reason, let us get familiar with a few terms. Insulin, insulin resistance, and metabolic syndrome. So what is insulin? Insulin is an essential hormone produced by the pancreas that helps to turn food into energy and thereby plays a key role in regulating blood sugar levels. For example, during digestion, sugar is broken down into glucose and enters the bloodstream, which serves as a trigger for the pancreas to secrete the hormone insulin. Insulin helps glucose to enter the cell for use as energy. So what is insulin resistance? Over time, due to the bad nutritional behaviors, insulin levels are persistently elevated. And because of that, insulin resistance gradually starts occurring. It starts when the cell in the body becomes less responsive to insulin, leading to an elevated blood sugar and insulin's level. And this can surely cause a cascade of metabolic disturbances. Now, what is metabolic syndrome? Metabolic syndrome is a cluster of conditions resulting from insulin resistance that occur together, increasing risk of health complications. These conditions include increased blood pressure, high blood sugar levels, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Therefore, insulin resistance is considered a key underlying factor in the development of metabolic syndrome, as it contributes to most, if not all, the components of metabolic syndrome. While insulin resistance primarily affects glucose metabolism, metabolic syndrome encompasses a wider array of metabolic disturbances, including the effects of fructose metabolism. Insulin resistance precedes and contributes to the development of metabolic syndrome, creating a cycle of worsening metabolic health issues. Insulin resistance, including the adverse effects of fructose metabolization, is the fundamental and primary factor behind many chronic diseases, including type 2 diabetes, heart disease, and even some cancers. Therefore, any strategy for treatment of metabolic syndrome must focus on treating insulin resistance by focusing on the consumption of glucose and fructose and seed oils. The three main macronutrients that provide energy to the body are carbohydrates, proteins, and fats. Generally, one of the main reasons for chronic diseases is the overconsumption of carbohydrates. It is quite interesting to note that the presence of carbohydrates inhibits the burning of fats for energy. What is also amazing is that if glucose is required, it can be produced by the body from fats and proteins through a process called gluconeogenesis. Carbohydrates are organic compounds found in plant-based foods consisting of sugars, starches, and fiber. They serve as a primary energy source for the body. Carbohydrates are classified into simple and complex carbohydrates. Simple carbohydrates are single sugar molecules and when digested, they are broken down into glucose and fructose, while complex carbohydrates like starches are composed of long chains of glucose units. During digestion, enzymes break down complex carbohydrates into simple sugars and are split again into glucose and fructose. These simple sugars are then absorbed into the bloodstream, where glucose can be used immediately for energy, while fructose is transported to the liver for further metabolization. In the next few slides, let us see how each of them, glucose and fructose, are metabolized by the body. Now let us look at the glucose metabolization, a process by which insulin supplies energy to the cells. As I said before, insulin is a hormone produced by the pancreas that plays a critical role in regulating blood sugar levels and facilitating the uptake of glucose by cells to be used as energy. Let's go through the description of how this happens. So, as soon as one consumes carbohydrates, that could be bread, potatoes, sugary drinks, etc., these carbohydrates are broken down into glucose and fructose. The glucose enters the bloodstream, causing blood glucose levels to rise. Fructose is metabolized to a different pathway and will be discussed a bit later on. So the rise in blood glucose levels signals the beta cells of the pancreas to release insulin into the bloodstream. Every cell in our body has insulin receptors. So insulin travels through the blood and binds itself to insulin receptors on the surface of cells, including muscle cells, fat cells, and liver cells. So when insulin binds itself to the cell's insulin receptors, it triggers a cascade of events inside the cell. And this includes the activation of glucose transporters to the cell membrane. In other words, it sort of opens the door in the cell to uptake the glucose. The glucose transporters facilitate the entry of glucose into the cell by allowing it to pass through the cell membrane. Inside the cell, glucose can be used immediately for energy production. Inside the muscle cell, glucose is primarily used for immediate energy needs and muscle activity. And inside the liver, glucose can be used to produce energy or be converted into glycogen for storage. So let us look at a process by which fructose is metabolized. Fructose is a sugar molecule found in carbohydrates, that is grains, starches, and sugars, also in fruits and vegetables. The metabolization of fructose happens in the liver. So after consuming carbohydrates, as we know, they are broken down into glucose and fructose. We have already discussed the metabolization of glucose. Let us now see how fructose is metabolized. Fructose is transported to the liver via the portal vein. It is a blood vessel that carries blood to the liver. Unlike glucose, which is metabolized in various tissues, fructose is primarily metabolized only in the liver. In the liver, fructose is converted into fatty acids through a process called de novo lipogenesis. These fatty acids are assembled into triglycerides, which are also fat molecules. And then triglycerides are packaged into very low density lipoproteins, in other words VLDL, and released into the bloodstream. Excessive intake of fructose can lead to the accumulation of fat in the liver, a condition known as non-alcoholic fatty liver disease, NAFLD. Fructose metabolization increases the production of uric acid, a byproduct of purine metabolism. Elevated uric acid levels can lead to the development of gout. Fatty liver impairs insulin signaling pathways, contributing to insulin resistance. Elevated uric acid levels are also associated with insulin resistance and metabolic syndrome. Chronic exposure to high levels of fructose and the resultant inflammation can impair the insulin receptor functions on the liver cells, again leading to insulin resistance. Insulin resistance develops into chronic diseases like gout, fatty liver disease, cardiovascular diseases, etc. Now let us go through a process of insulin resistance and see how it develops in our bodies. The development of insulin resistance is a complex process influenced by various factors including genetics, lifestyle, and the environment. Insulin resistance is a condition where the body's cells become less responsive to the hormone insulin due to a variety of reasons. In the process of metabolizing glucose, it leads to higher levels of glucose in the blood. The quality, quantity, and frequency of meals play an important part in the development of insulin resistance. Consuming a diet high in refined carbohydrates, sugars, and unhealthy fats can lead to frequent spikes in blood glucose and insulin levels, and thereby to insulin resistance. I would like to present you with an example of how the development of insulin resistance begins to show signs of, and how it occurs progressively over several months, years, and decades. As you know by now, the unhealthy nutritional behaviors over several years and decades leads to insulin resistance. Let me show you how the glucose and insulin rises and falls for people adopting a healthy nutritional behavior. So you start by consuming your first meal, and as part of digestion, glucose enters the bloodstream, which triggers the pancreas to secrete insulin. So the glucose rises and is followed by insulin to help that glucose uptake into the cells for energy. Over the next few hours, both glucose as well as insulin levels come down, and this is considered to be a healthy process of glucose metabolism. So now you get hungry and you go and have your second meal, and then after another few hours you get hungry again and you have your third meal, and the same process is repeated. The insulin and glucose goes up and they come down after a few hours after each meal. At the end of the day, the levels of both glucose and insulin are in healthy range. So that's for people who are adopting a healthy nutritional behavior. Let us see what happens for those people who adopt an unhealthy lifestyle. You consume your first meal, and as part of digestion, glucose enters the bloodstream, which triggers the pancreas to secrete insulin. So glucose rises and is followed by insulin to help the glucose uptake into the cells for energy. However, even before the levels of glucose and insulin has a chance to come down, you are eating a snack, and that makes the glucose and insulin rise up again. And once again, even before the levels of the same glucose and insulin has a chance to come down, you having your second meal, and then another snack, and then your third meal, and then again another snack. During the whole time, glucose is on the rise and pancreas secretes more and more insulin to keep the levels of sugar in check. And this happens throughout the day. This is unhealthy. And over time, it leads to hyperinsulinemia, which leads to insulin resistance. The time frame for the development of insulin resistance can vary significantly based on individual factors. For some people, insulin resistance is developed over a period of years and decades. So, for example, the early stages may take months to years. Insulin resistance can develop gradually over months to years, depending on lifestyle and genetic factors. Poor dietary habits, physical inactivity, and weight gain can accelerate the process. The pre-diabetic stage. It can take several years for insulin resistance to progress to pre-diabetes stage, where blood glucose levels are higher than normal, but not yet in the diabetic range. And the last stage is the progression to type 2 diabetes. Here again, it takes several more years, and without intervention, insulin resistance can progress to type 2 diabetes over the course of many years. The pancreas compensates by producing more insulin until it can no longer keep up the body's demand, leading to insulin resistance and elevated blood sugar levels in the blood. So, what are the key factors driving insulin resistance? As we know, insulin resistance is the primary underlying mechanism of metabolic syndrome. Insulin resistance occurs when cells in the body become less responsive to insulin, leading to elevated blood sugars and insulin levels. This can cause a cascade of metabolic disturbances. The following are risk factors of insulin resistance. Obesity, especially abdominal obesity, is strongly associated with insulin resistance and metabolic syndrome. Unhealthy diet. Diets high in refined sugars, unhealthy fats, and low in fiber can lead to weight gain and insulin resistance. Physical inactivity. Lack of regular exercise contributes to weight gain and insulin resistance. Genetics. Family history can play a role in an individual's risk of developing metabolic syndrome. And finally, age. The risk factor of metabolic syndrome increases with age. As you already know, metabolic syndrome is a cluster of conditions that occur simultaneously. These conditions are developed because of insulin resistance. The following are the various examples of health conditions that can be developed due to insulin resistance and which lead to the diagnosis of metabolic syndrome. So you have increasing the risk of heart disease, stroke, type 2 diabetes, increased blood pressure, high blood sugar levels, excess body fat around the waist, and high triglyceride. Let us look at the risk factors for metabolic syndrome. A person is diagnosed with metabolic syndrome if he or she has at least 3 of the following 5 risk factors. The first one is abdominal obesity. For men, a waist circumference of 40 inches or 102 centimeters or more. For women, a waist circumference of 35 inches or 88 centimeters or more. The second one is elevated triglyceride. Triglyceride levels of 150 milligrams per deciliter or higher, or being on medication to treat high triglyceride. Reduced HDL cholesterol is the third one. For men, HDL cholesterol levels less than 40 milligrams per deciliter. For women, HDL cholesterol of less than 50 milligrams per deciliter, or anyone being medicated to treat low HDL cholesterol. The fourth, increased blood pressure. Blood pressure of 130/85 millimeters of mercury or higher, or being on medication to treat high blood pressure. And the last one is elevated fasting blood sugar. Fasting blood sugar levels of 100 milligrams per deciliter or higher, or being treated for high blood sugar. Let us look at some of the common complications that arise as a result of metabolic syndrome. The first one is cardiovascular disease. There is an increased risk of heart attacks, strokes, and other cardiovascular conditions. Type 2 diabetes. Elevated blood sugar levels and insulin resistance significantly raise the risk of developing type 2 diabetes. Liver disease. Non-alcoholic fatty liver disease, NAFLD, is commonly associated with metabolic syndrome. Polycystic ovarian syndrome, PCOS, a hormonal disorder often linked to metabolic syndrome in women. And kidney disease, increased risk of chronic kidney disease due to high blood pressure and diabetes. So let me summarize and give you the essence of this presentation. What is a healthy lifestyle? It is physical, mental, and social well-being. What are the causes of chronic diseases? It's the overconsumption of carbohydrates, unhealthy fats, and processed foods together with inactivity. And what is insulin? Insulin resistance and metabolic syndrome. Insulin is a hormone to regulate blood sugar and supply energy to the cells. Insulin resistance occurs when cells do not respond to insulin, and 3 or more insulin resistance complications are referred to as metabolic syndrome. What are the reasons for insulin resistance and metabolic syndrome? Overconsumption of carbohydrates, unhealthy fats, and processed foods together with inactivity. What are the complications of insulin resistance and metabolic syndrome? Cardiovascular disease, type 2 diabetes, fatty liver disease, kidney disease, PCOS, etc. So that concludes my presentation on the reasons behind chronic diseases, particularly as we age. Our bodies are remarkably resilient and capable of withstanding significant challenges. However, consistently overfeeding or relying on processed foods over time is a major contributor to the deterioration of our health, often leading to conditions like metabolic syndrome. Doctors often prescribe medication that only suppress the symptoms of a diagnosed condition without addressing the root cause. If these medications cause side effects, additional drugs are frequently prescribed to manage those side effects, creating a cycle that leads to a person taking multiple medications for a single disease. And due to conditions like insulin resistance, you might even be diagnosed with additional health issues, perpetuating this cycle. As a result, many older adults find themselves using special pill organizers to manage the numerous medications that are prescribed. As you may have noticed, This presentation focused on the causes of these diseases, but did not address what can be done to improve your health, especially if we are already facing adverse conditions. In my next video, I will dive into these solutions, sharing how I've personally managed my health issues, including some successes in reversing them by prioritizing better nutrition and healthier eating habits. Thank you for watching.